Good afternoon, ladies and gentlemen. Welcome to another episode of Fireside Chat with Misha Ahmad on CxO Global TV. CxO Global Forum is an information sharing platform which involves our influencers who are heads and VPs of large companies. These people, with no doubt, have made excessive changes in their working arena. Our aim is to get digital transformation, especially in digital world and innovation. However, it's an honor for us in contributing to the world of knowledge economy. So today we have Mr. Bilal Amjad with us, who is CEO InstaCare. Thank you so much for joining us, sir.
Welcome.
Sir, first of all, I'll be very good to know about your if you share your educational background, your start in your professional career. How did you take up things? Please, sir.
Yeah, thank you so much, Misha. I'm Bilal Amjad. I'm the founder of and CEO of InstaCare. I graduated from local university, Comsets University, as a software engineering graduate. After that, I worked for some leading tech companies like Microsoft, and I was the Microsoft Most Valuable Professional Award holder for the 4 years. And after that, and during that period, I was also working for some leading health startup in Pakistan, startup ecosystem like Zameen.com. I worked at bookme.pk also, and then I actually found some gap in the healthcare industry, and I decided to move to start my own venture called InstaCare.
Right, sir. As we know that you started this venture, InstaCare. Please, we want to know about InstaCare. What does it? What kind of services it provides? Can you please share?
Yeah, so InstaCare is basically a digital health company, and what we do is that we digitalize healthcare providers to make them accessible and more productive. We offer two products to this industry. Like one, we have a digital health digitization product which we call Smart Clinics. It is for healthcare providers who are operating their own clinics. They can use this product to digitalize and automate their workflows to provide maximum ease to patients, as well as to reduce the burden which is on their shoulders. And what we do is that we digitalize a clinic, and then we actually make it accessible for patients as well. So we list those healthcare providers on another platform which is for patients, and we call it instacare.pk. And patient visit that website and to explore healthcare providers like doctors, hospitals, labs, and pharmacies, and they can avail all those healthcare services at their doorstep as well as in person by visiting those clinics.
Right, sir. It's very interesting and very good to know that you're working for the cause of humanity or for the cause of helping others. I am very excited to know from you that how did this idea came up in your mind to start such kind of venture?
Yeah, so I back in 2017, I found some gap in this healthcare industry while we were seeing that communication was being digitalized through different platforms like WhatsApp, Facebook, and things like that. We see that how transportation industry got transformed digitally by we saw that Cream started operated, and there were few other companies also. But that healthcare space in Pakistan was quite neglected, and till date it need to be addressed, but it always neglected. This specific industry is being neglected. But I saw this gap that more than 95% of this industry is still on working in a paper-based environment, which is actually the root cause of many problems, including medication errors. And according to a study which suggests that in Pakistan, the sixth largest cause of deaths is now medication errors. And we can actually eliminate or reduce the medication errors with the help of digitization softwares like InstaCare, Smart Clinic, which helps doctors to take better clinical decisions for their patients. Through Since we have developed this platform using technologies like machine learning and AI, which helps them study their own prescription patterns and help also to prescribe the accurate drugs to the patients based on their profiles. So there was a huge gap, and still that gap needs to be filled by through digitization. And I think Instacare is actually on the right track, since we are working since past 4 years, and the journey have been very amazing so far.
Right. So, as you're working on this, as you told us that since last 4 years, you've mentioned about the gap in health services. I want to know that, do you see that gap growing, or coming to a lesser point whenever you've started this the health services?
Actually, previously this gap was growing. I want to state the number of WHO, World Health Organization, which states that in Pakistan, the doctor-patient ratio is 1:1300, which means that a doctor have to actually consult 30. One doctor has to serve 1300 patients, which is like a huge number for a doctor to serve such a large volume of patient, which is impossible for a patient, for a doctor, right? So I've seen that this gap is actually increasing. There are several reasons. One major reason is that our population is growing quite rapidly, but the doctors are not growing at that fast pace. We have just approximately 280,000 doctors working in Pakistan. We have a large issue of quackery also. Like our licensed issues, doctors are approximately 280,000, but the volume of quackery is over half a million. So your quacks are actually, the figures are like double of the real doctors. So whenever a patient is actually visiting a doctor, there are high chances they are visiting actually a quack. So there is a huge gap. But the good thing is that along with InstaCare, there are many other digital health companies who are now operating in country, and somehow we have figured out the problems. Every digital health startup have figured some specific problem to fight for, and I think now the time has came when this gap will eventually will start reducing. But there are some more problems, like we need more doctors to serve this population, to make our doctor ratio patient better. But obviously startups are playing a vital role in improving the overall healthcare system of Pakistan.
Right. I am a little bit, interested in knowing that InstaCare is basically it's a health tech company, right? So, which provides services to the patients. How can the people from the rural areas, how can they reach this platform, or they can take the services from it?
Yeah, so in remote areas, mostly the problem is not about the access of internet, but their problem is about the awareness of technology. Although the people in those areas are still having smartphones, or like we have seen smartphones being used in those areas, but they don't know how to use those smartphones properly. But we have also seen that in those areas, even people are using WhatsApp for video calling with their loved ones who are actually working in different cities, so they know how to use such applications. So actually Instacare have made a very simplified application. But yes, the regions which you are talking are the remote areas mostly, so they are not very tech savvy, and for them we have launched the helpline number also. And people can actually, we receive daily hundreds of calls who are actually seeking some healthcare advices and healthcare services, and our team connects them with the right healthcare providers.
Well, that's very good to know from you that not only people from urban areas but also from the remote areas or rural areas can take services from InstaCare. Um, uh, I will be, asking you further that since you're part of InstaCare since 4 years, you say. Correct me if I'm wrong. How have been this journey since so far? What kind of challenges you faced earlier when you started it, or any challenges that you've been facing till now?
Actually, we have been on a roller coaster. So sometimes we have seen quite ups and then quite down. We actually got to face many challenges. Those challenges actually we face challenges like every day. We have to face challenges because we are operating with limited resources. We have limited team. We have huge challenges. We have we have many especially in digital health space, we see that our customers are sometimes reluctant of using our technology or any technology. There's several challenges which we have to face that, but the good thing is that these challenges have eventually been solved. Every day we have to face new challenges, and I have said that it's been a roller coaster, so I can't actually mention what exactly the challenges were, but there were several challenges which we have to face and we have to
Right,
solve actually.
right. So, for the we know that you have this expertise in digital transformation, cloud computing, and all this world of IT. What, in your opinion, or what do you think about the future of IT going in Pakistan?
I think the future, undoubtedly, the future of ICT in Pakistan is quite bright, and we have seen that how our e-commerce industry is growing, and it's growing massively. Our software industry is growing. Digital health space is growing. We have seen lots of startup coming in, clean tech and ed tech also. So the whole ecosystem is growing actually, and we have also seen that how the companies have actually now tested the 5G technology after getting a huge success in 4G and 3G. So I can say that the future is quite bright, but obviously we need some government support also to improve, to create some policies to support this ecosystem, to support startups as well as the companies, and we all need to work together actually. We need to build synergies between all the stakeholders to actually to grow this industry in actual meaning.
Right. Well, very well said. Uh, Further, I want to know that how do you think, or what, in your opinion, we can fill this gap between industries and the world of IT?
Actually, it depends that what gap we are talking about. If there are different kind of gap. If we are talking about filling the gap of skills, then that for that we need help from our healthcare educational institutes, as well as we need to fill the gap through industry side also. That and for to filling this skills gap, we need IT industry as well as the education industry to work together to, because the biggest challenge we face, and I know many other IT companies who are facing, is about the talent. We are not actually getting the talent that we need to grow our this sector. So that gap need to be addressed, and there are several more challenges which you can call that gaps. It depends that what gap you are actually talking about. So I've just
Right.
mentioned one, so if you can name any challenge, so I can better explain according to my knowledge.
I think that that was enough of my question.
Mhm.
Getting back to InstaCare, as you're serving for the humanity. Uh, I want to know that what achievements have you got since so far?
Yeah, so really feel great when we get recognized by local as well as international organizations. During the COVID first wave, clinics were shut down, healthcare providers were facing challenges, patients were facing challenges. Neither patients want to go to visit hospitals or clinics, and nor the doctors were very comfortable checking the patients. So at that time, we actually made our telemedicine services absolutely free, and we actually provided over 20,000 consultation in the during the first wave absolutely free. And we actually onboarded the doctors, more than 200 doctors across Pakistan. They were multilingual, not just English and Urdu. They were also Pashto speaking doctors to serve the KPK region. We did some amazing we actually did some amazing effort. My team have done amazing effort during that time, and to get our and actually USA recognized our efforts during that period. I recently won the Commonwealth COVID-19 Hero Award, and I really feel proud about that award, because it was I was representing my country in that awards, and I won that. Apart from this, I actually represented InstaCare as a Pakistani health tech company in Turkey during the Takeoff Istanbul award, and we won that also as a top foreign companies. Apart from this, I have received Microsoft Most Valuable Professional Award, and I was the MVP for 4 years consecutively. And apart from this, I have won a APAC Insider Healthcare Entrepreneur Award, and there are several more awards that I have won, and I have named some very popular awards.
Well, that's very good to know from you, and congratulations for all these achievements,
Yeah,
and
thank
best
you.
of luck for future. So
Yeah, thank you so much.
before ending this our session, I would like to ask you that what do you think, or what's your opinion about forums like CXO Global?
I think CxO is doing a fantastic job. I came to know that how you give visibility to companies. Today I am talking about InstaCare on your platform, and I have seen that you have conducted some sessions for other companies also. So it is very important that when we all are working in the same industry, so we need to know each other, that what services, what products someone is offering, so that rather rebuilding the wheel, or rather rebuilding that product ourselves, we can actually leverage our partners or our companies who are operating in Pakistan with, we can actually take advantage of them, and we can partner up, and there are several more synergies that can be met through CxO. I think this is a fantastic job that you have done, and I really wish you and your team all the very best for all your great initiatives ahead.
Well, thank you so much for your wise words. Ladies and gentlemen, this was it for today. We thank Mr. Bilal Amjad once again. Thank you so much, sir, for giving us your time and coming to our platform. If you have any queries, if you want to know anything about InstaCare, you can visit Mr. Bilal Amjad's profile, or even InstaCare's profile. Don't forget to give us your reviews. Keep watching. Thank you.